Good afternoon, everyone. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We are giving our regular weekly COVID-19 update. I'm joined today by Dr. Geraldine Luna from the Chicago Department of Public Health, one of our medical directors, who will give some remarks in Spanish. So first of all, the travel advisory for the second week in a row applies to the whole country. Every state, every territory is experiencing a major COVID-19 surge, just like we are here in Chicago. And so nothing has changed here in terms of how that is defined. As a reminder, if you are unvaccinated and you are traveling, the expectation is that you're testing and quarantining upon return to Chicago. Where we look in a little more detail at what's happening within the U.S., obviously, again, the whole country is surging. The darker purple here represents places where we are seeing more and higher COVID cases. I do want to put in a little bit of perspective, though, what we're seeing nationally across Illinois and in Chicago. So nationally, currently, we are averaging 222 COVID cases being diagnosed per 100,000 people per day. That's very, very high. Illinois, 249 diagnosed daily cases per 100,000 people. Chicago's at 177 diagnosed daily cases per 100,000 people. Now, all of these are very, very high, just to be explicit about that. But we are feeling concerned by seeing surges around the country, even while we may be seeing the beginnings of some flattening here. And I know that's what people are interested in. Where we look at Chicago data specifically, as you know, each week we update this, and our cases diagnosed per day, our test positivity, both remain in the very high transmission rate. They are both just very gently, potentially beginning to decrease. Too early to call, and we'll talk about that in a second. Our hospital beds remain at the very high level, averaging over 1,250 a day. Those continue to increase. We would expect that, given that as people get infected, and we still are seeing a lot of people, especially those who are not vaccinated and boosted, if they're getting COVID right now with Omicron, many of them are being admitted to the hospital. So we continue to see that increasing. Similarly, our ICU capacity remains at that high transmission or high risk state, also increasing. So to the point, our case rate's extremely high. And honestly, the difference between 4,793 cases today versus just over 5,000 yesterday, mostly it's high. We did have our highest daily total 3 days after Christmas, 7,871. Different testing patterns can affect these numbers overall. I am feeling good about the fact that potentially we are seeing at least some slowing of increase, but we do need some more days of data to feel more sure about the direction things are heading. I think there's a good chance this will be over 5,000 again. The good news is that if it's not 7,000 and 10,000 and 12,000 and going from there. Our test positivity similarly remains very high. Again, possible sign of an early decline. It is too early to call. I want people to understand why some of that is. It's not that the systems aren't set up to handle this, but there is a potential for some delay in data reporting. To give you a flavor of this, hospitals are extremely stretched right now, and so we sometimes see some delays in terms of the details of who's being reported. The computer systems, at the state level that are handling these very large numbers, it's just taking longer to run the data sets. Even labs, in a lot of cases, that are doing many more tests than they've ever done, we're sometimes seeing a little delay in terms of what's coming through there. So we are on it and we are following closely, but this is where I just want people to recognize we do need to see some more days of improvement here before we could for sure say that things have peaked. The 18.9% positivity, just for awareness, is down from 21% the week before. Hospitalizations remain at the highest point that we're seeing. We continue to have capacity, although the hospitals are very stretched. 18% of our non-ICU beds across the city are open. 10% of our ICU beds are open, and a little higher than that for pediatrics capacity. Where we look at the details here, we are averaging 1,562 Chicago residents hospitalized with COVID outside the ICU. For ICU, we are averaging 312 Chicagoans in the hospital with COVID in the ICU. I got a question this morning. I heard that Omicron is a lot less strong. Is there anybody still going on a ventilator? Yes. There are 167 people on average right now on ventilators with COVID-19 in Chicago hospitals. Those are people, almost all of them infected with the Omicron variant, and almost all of them are people who are not vaccinated. Hospitalizations for children do remain low. I encourage you to look at the dashboard if you want to see the details, but breaking down by age here, that dark blue line in the bottom are hospitalizations in 0 to 17-year-olds. Overall flat, although we have seen some increases, especially again among unvaccinated children, particularly unvaccinated adolescents. You see a big increase in people in their 80s especially. That's that light gray line. If you have not had a vaccine yet and you are older, now is the time, because you are at extremely high risk, not just of getting COVID, but of potentially ending up in the hospital, especially if you're older with underlying conditions. What is different with Omicron is that it is this different pattern where everybody you know probably if they have not themselves recently had COVID, they certainly know somebody who has had COVID. You see this enormous increase. This is national data, that the cases are shooting up at levels that we had not previously seen, whereas in comparison, over the pandemic, hospitalizations, they're high, and I'm worried about the hospitals, but those cases are not turning into hospitalizations in the same ways that they were, because primarily people, most people are vaccinated, and then similarly deaths have not tracked. Where we look at that number for Chicago and put that kind of in perspective. So these are our daily averages going throughout the whole pandemic. On the left, we have cases, and I want to point out that this is on a scale of 1,000. So it goes 1,000, 2,000, 3,000, 4,000, and you see that this number where we are now at about 5,000, extremely high compared to anything we've seen before. Hospitalizations and deaths are on a scale of 100 because 90% plus always of people who get COVID don't get admitted to the hospital. But we see that both of these numbers are, both the cases and the hospitalizations are the highest that we've seen. But in terms of that comparison, thankfully, vaccine is playing a really critical role in helping not overwhelm our hospitals. And then when you put these in comparison, when you compare this to our 2020 peaks prior to this, cases are more than double what we saw, 223% of our prior peak. Hospitalizations are at 146%, and deaths are still at about half, 54% of the previous peak. What do we do to protect ourselves? The messaging has not changed. It is just critical right now in the surge that we are doubling down on all of these mitigations. The most important one, full stop, is getting vaccinated and getting boosted. Anybody who is 5 months after completing their Pfizer or Moderna vaccine who is over the age of 12 is eligible and should receive a booster. Anyone who got a J&J vaccine 2 months later is eligible and should receive a booster. And our recommendation for people who got J&J first is that that booster should be Pfizer or Moderna. Other than that, whatever you're able to find, whichever you prefer in terms of boosters. But masking up, backing up, washing up, testing up, these remain important. So we share this data every week, and I just want to say again to you, this is hospitalization data in the city of Chicago. That red line is people being hospitalized right now in Chicago who are unvaccinated. The light blue line are people who are fully vaccinated but not boosted. The dark blue line are people who are boosted. Over and over again, we've said this, but the numbers continue to hold. People, depending on the week, 8 times, 9 times, 10 times, depending on the age, 20 times, more likely to be hospitalized if you are unvaccinated at this point. It's very dangerous right now, honestly, to not have a vaccine. Go ahead. Most children, similarly, who are hospitalized with COVID-19, and yes, those numbers have also gone up, are unvaccinated. That blue line that's so much higher than the rest, those are unvaccinated 12 to 17-year-olds. The dotted lines down near the bottom are vaccinated kids. So please, also, children, important to get vaccinated. Young adults, same thing. Somebody asked me yesterday, isn't it true that no young adults have died from Omicron? I wish I could say that was true. It is not. Right here in Chicago, there have been 18 to 29-year-olds, at least 3 of them, just since Omicron, that have died of COVID-19. None of them were fully vaccinated. Please, even if you're young, don't take your chances. Right now, get a COVID vaccine. Go ahead. Middle-aged adults or working-age adults, same thing. That green line is our unvaccinated 50 to 64-year-olds who have not yet had a vaccine. The dark yellow solid line is 30 to 49-year-olds. Right down near the bottom, working-age adults who have gotten their booster, that risk for hospitalization is near zero. The risk for cases is not near zero. We are seeing breakthrough cases. I know you've all seen this. But when I hear about a breakthrough case, my first question is this person fully vaccinated and boosted? I ask that before I even ask what are their underlying conditions, what is their age. It is the most important predictor of whether you will get seriously ill if you are infected with COVID. And then finally, the elderly. Look at those dark lines. The red and the black there, those are people 65 to 79 and over 80, still unvaccinated in Chicago, still being hospitalized at the highest rates. Are we seeing some more breakthrough hospitalizations in people who are older? We are. Older people more likely to have underlying conditions. But if you're not vaccinated or you know anybody who isn't, the older they are, the higher that risk gets. And it is just critical. Boosters also especially important for these older adults. We're doing well in terms of vaccination, seeing nice increases after the holidays. Numbers are up again. You might recall Protect Chicago 77 hit a goal of 77% of Chicagoans over the age 12 getting our first dose. I'm happy to say that really just in this first week here, we've hit 77% of all eligible Chicagoans over the age of 5 have now received at least 1 dose of a COVID-19 vaccine. When we launched Protect Chicago 77, children over 5 were not even yet eligible. But I've been pleased with the uptake among younger children, and I please encourage you in terms of helping keep our schools as safe as they can be, helping keep your children as safe as they can be, helping decrease the spread of COVID within families. Now is the time, even for young children that are unlikely to have a severe outcome, to get vaccinated. And where we do break this down by age, I just wanted to highlight that we are well above the national average, where we look at the national average for our young people being vaccinated. Nationally, still fewer than 1 in 4 5 to 11-year-olds have had a first dose of COVID vaccine. We're at 38% here in the city. That is not where I want it to be. I need it to be higher than that, but I want you to know we're making good progress, and there is a lot of pediatric vaccine available. Similarly, 12 to 17-year-olds nationally, about 64% have had a first dose. We're at 74% here, and pleased to see that. In CPS, where there has been a lot of focus, of course, over these last few weeks, 5 to 11-year-old vaccination coverage is essentially the same at the city as it is within CPS. We have more work to do among adolescents in particular in CPS, and I'm really pleased with the end of the work stoppage, in particular a lot of the commitment and work of the teams to come together and really work on making sure children are signed up for testing, but even more important than that, answering questions about vaccination, getting parental approval to vaccinate children, and guardians and grandparent approval, because this is the most important thing, full stop. Some good news, and then we'll finish up. So I know that the data is maybe giving you a little sense of some potential relief. I am feeling that, but I can't say for sure that we are flattening or past a peak. But what I can say is there is real good news in terms of some of the response and the ways that it's ramped up. So on KN95 mass distribution, CDPH distributing 1.9 million KN95 masks this week into communities. We made sure CPS had some for staff right when they were coming back. They separately are working to make sure there are KN95s for staff, for students. But this is right now, this week in communities. The aldermen aldermen. Each alderman got 20,000 yesterday. Half of them got them yesterday. Half of them are getting today. Wednesday through Friday, we have more than 100 community-based organizations, everything from churches to libraries to health organizations, our partners that know how to do this well, and we're getting them all out this week. So reach out, and if you KN95 mask not required, just to be clear, but if you're looking to upgrade your mask, we are working to help make those available. Those also, the supply chain for those is okay, so you're also able to purchase them, but we know a lot of people, frankly, even a 50-cent or $1 mask is just one extra cost at a time that's difficult. So the KN95 masks look like this. We are also distributing, and I hope you see some of these palm cards and distributions that come with the masks that are just, there's been such a lot of messaging recently, letting people know if you're sick, what do you need to do? Essentially, stay home. Any positive test is positive, and stay home for at least those 5 days, assuming that you're feeling better. Also guidance about masking, testing, and monitoring symptoms. Also some good news on testing, and I know this has been a real stress point for everybody in Chicago. We continue to really grow capacity across the city. It's really important we prioritize our highest risk settings as the health department, so our long-term care, our shelters, our clinical settings. When we're thinking about where to first put testing and grow testing, where test results influence immediate public health actions, where the highest risk people can be quickly linked to the antiviral treatment and care that help keep them out of the hospital, where testing capacity can offload pressure on emergency departments, and then where people with fewer links to health care and fewer resources can access. So while testing is growing everywhere, this is where we're especially focused. Rapid tests have been the thing that have been the hardest to find for everybody. On a personal level, the health department, as you know, our back orders to November had not been filled as the federal government has been working to centralize that, which I do support. So I'm happy to say the federal supply of free rapid tests has started specifically to federally qualified health centers in Chicago. We checked in across the system. They'd received the first 25,000 or so last week. That should be ramping up to about 150,000. Why are they going there? Because that is where we have the ability to also, a lot of people who have barriers to care otherwise use those sites. You don't have to have insurance, et cetera. But also that's where a lot of people who have underlying conditions and are high risk already have established care, and we're also working to make sure that the treatments that people can take if they are very high risk are linked right there, and we can move to rapidly getting a test result, rapidly getting that medication which you need to take early after being diagnosed with COVID for it to be effective. In terms of testing sites, we are also funding additional community-based testing sites. Just to give you a quick sense of this, we're working with a whole host of folks, but for example, one of the places we're looking to stand up is actually a testing site in the Illinois Medical District. That might sound a little strange. There's all these hospitals, there's all these clinics, but you know what we're seeing? There are still a lot of people going to emergency departments when it's not an emergency to get a COVID test. And if there's the ability for when people are coming in, it's all about protecting the hospitals. All they need is a COVID test to say, you can sit here for many, many hours, or you can walk a block and get a COVID test. That's where we put that kind of resource. In the same way, we're looking down at Daly College, working to expand testing, but I just wanted to give you a flavor of how we're prioritizing that. We also already work with Shield, Illinois, which, boy, have I answered a lot of questions about that over the last week. But where we already have this in place, we've been working to expand operations to open to the community. Really pleased to say the federal courthouse, for example, right downtown is going to be open to the public tomorrow. CDPH is funding that additional expansion. CHI.gov/COVID test remains the best place to get Chicago-specific information about how to find a test. And if you call our same number, they will stay on the phone with you until they figure out how to help you get a test if you need one. The last piece of good news is on vaccine. We've made a decision with the surge and with really the increased attention, which I love, on vaccination. We are going to do another full round of the CDPH weekend family vaccination clinics at city colleges that will extend again through late February. So a lot of you know these sites. They've been our mass sites from the beginning. We have pediatric vaccines, we have adult vaccines, we have booster vaccines. We, again, will be operating Saturdays and Sundays at all the city colleges. We'll be going twice to each one, so you can get your first and your second, and you can sign up online just like always. Finally, our at-home is going really strongly. We're doing more than 1,300 mini clinics at people's homes each week. And if you know someone for whom it is hard to get out of their house to get a vaccine, or work schedules make it difficult, we're the only large city, we might be the only city that still says, doesn't matter who you are, we will bring vaccine to your house free of charge. We'll set up an appointment Monday through Sunday, 7 days a week into the evening. There's a lot of people interested in this right now, which is good. So if you call, will you get an appointment tomorrow? You will not. But will we get you an appointment in a week or two? Yeah. So if you know someone, especially who's older, please encourage them to sign up for Protect Chicago at Home. Last piece, as a reminder, a positive test right now is positive. I don't care what kind of test it was. I don't care what setting it was done in. We've heard people say, I'm worried that the test that I got at school isn't a good test. I'm going to go out and seek a second and a third and a fourth test. I've heard people say, I took an at-home test and I'm just not sure. It was positive, but I think I should go and get another one. No, a positive test is a positive test. I have no concerns about whether test results that are coming back are accurate in this setting. So treat a positive as positive. Please do not go trying to seek additional tests in that setting, just because it is putting additional strain on the testing system while we continue to build it. And with that, a reminder, as always, chi.gov/COVIDvax if you've got questions for us, or always you can call 312-746-4835. Thanks. I'll hand it to Dr. Luna for some quick comments in Spanish and then take questions.
Thank you, Dr. Arwady. Y buenas tardes a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y hoy les estaremos brindando actualizaciones de los datos de COVID-19 del Departamento de Salud Pública en español. Actualmente, 49 estados y 4 territorios permanecen en el aviso de viaje de Chicago. Esta es la segunda semana consecutiva que todos los estados y territorios de los Estados Unidos están en alerta de viaje. Eso significa que más de 15 personas tienen COVID-19 en un promedio de 100,000. Los números de COVID están altos a nivel de toda la nación. Hoy tenemos un promedio de 4,793 casos por día, 189 hospitalizaciones y tenemos una positividad de 18.9% en Chicago. Ese es el momento donde hemos visto los números más altos récord desde el comienzo de la pandemia. 4,793 casos promedio por día es alto. Vimos una bajada muy sutil, pero no sabemos lo que significa todavía. Así que tenemos que seguir a la vanguardia, tenemos que seguir vigilando esos números y, más importante aún, tenemos que tomar las vacunas y los refuerzos para obtener esa máxima protección contra el COVID-19, sus infecciones y contra la presentación severa de la enfermedad. Un recordatorio de que todos los habitantes de Chicago vacunados tienen mucho menos probabilidades de experimentar una enfermedad grave en el COVID-19. Y una dosis de refuerzo adicional claramente brinda una protección adicional que no habíamos visto antes con otras presentaciones del COVID, pero con esta variante Omicron, que es capaz de evadir las respuestas inmunes previamente a vacunas y a infecciones naturales de la enfermedad, es cuando vemos la importancia de esa protección, esa capa adicional. Las hospitalizaciones más altas entre las personas se encuentran en los no vacunados. Y repito, las hospitalizaciones y muertes más altas se encuentran en los no vacunados. Las hospitalizaciones, aun cuando hemos visto un alza en los casos de hospitalizaciones pediátricas, los números de niños de 0 a 17 años sigue siendo muy bajo comparado con otros grupos etarios, especialmente nuestros pacientes de 65 años para arriba. Las camas de hospital de hospitalizaciones en este momento han subido a 1,562, dejando una capacidad de 18% en nuestros hospitales. Esos son números récord números no antes vistos. Las camas de intensivo están ocupadas por pacientes de COVID-19, se encuentran en el censo más alto. Actualmente tenemos 312 camas ocupadas por pacientes de COVID, con una capacidad residual de un 10%. El riesgo de hospitalización aumenta con la edad, aunque el riesgo de los adultos de mediana edad que recibieron una dosis de refuerzo es casi cero. Las tasas de vacunación siguen aumentando. El riesgo de infección es mucho mayor en residentes de edad avanzada, no vacunados, especialmente cuando hablamos de nuestros pacientes de 65 años, cuando las comparamos con la contraparte vacunada. El 77.5% de los habitantes de Chicago elegibles 5 años en adelante han recibido ya por lo menos una dosis de la vacuna contra el COVID-19, y eso nos llena de alegría porque vemos que la tasa de vacunación sigue aumentando paulatinamente. 69.4% ya ha completado la serie de vacunación completa. Las tasas de vacunación de edad continúan aumentando y se encuentran por encima del promedio nacional de Chicago, así que felicidades a todas aquellas personas que están decidiendo por esa protección. El 38.3% de los niños de 5 a 11 ya han recibido una dosis y 73.5% de los niños de 12 a 17 ya han recibido una dosis de la vacuna contra el COVID-19. Estamos encantados de anunciar que hoy el Departamento de Salud Pública está ampliando las clínicas de vacunación familiar en los City of Chicago para cubrir los fines de semana. Estos eventos ofrecerán vacunas pediátricas de Pfizer contra el COVID-19, así como la vacuna de Pfizer para mayores de 12 años y dosis de refuerzo para todos los habitantes elegibles de Chicago. Las clínicas de los City College estarán abiertas de 9 a 2 de la tarde y es necesario registrarse si desea y comenzará hoy mismo el proceso. Se prefiere que se registre para tener los suministros en sitio, pero están disponibles al público. Las familias también pueden buscar su vacuna COVID-19 en proveedores de atención médica, sitios de CPS, farmacias locales, hospitales, y en nuestro programa de Protege a Chicago Plus al hogar, donde vamos al hogar y vacunamos hasta 10 personas sin necesidad de presentar identificación gubernamental y sin necesidad de tener una aseguranza médica. Las dosis de refuerzo para cualquier persona de 12 años en adelante se pueden recibir ahora, al menos 5 meses después de su dosis inicial de Moderna o de Pfizer, y al menos 2 meses después para personas que hayan recibido Johnson & Johnson. Todos los niños de 5 a 11 años serán elegibles para los $100 de incentivos cuando reciban su evento de vacunación primaria en cualquiera de nuestras clínicas del CPH. Tenga en cuenta que las dosis de refuerzo, si bien están disponibles en eventos del CPH, también a través del programa Protege a Chicago Plus la pueden recibir, pero no califican para incentivos si estamos hablando de refuerzos. La mayoría de los lugares de vacunación, los padres deben acompañar a sus niños. La excepción incluye las clínicas de vacunación ubicadas en las escuelas del CPS y los centros de salud de las escuelas y algunos proveedores de atención médicas que ya tienen formularios de consentimiento firmados por un padre o tutor. Para cualquier otra información relacionada a vacunas, por favor, comuníquese al chai.gov/COVID-Packs o al 312-746-4835 y cuídese, Chicago. I'll leave it now with Dr. Arwady for questions.
Questions, if I got a mic here. You got a question? You can identify yourself, please, and limit to one and a follow-up.
Sure. Dr. Arwady, Ravi Bajwal, ABC7. Talking about the distribution to the aldermanic offices, they clearly are starting to get a lot of calls from people saying, we need those masks, and now we're starting to see, I won't mention which ones, but they're saying, aldermen are saying, you know, these are mine to hand out. They're not going through any sort of systematic process that the city is describing. Why such a focus on the aldermanic offices instead of the secondary part, which you talked about, libraries, community organizations, and so on?
So we're doing both. and just to be really clear about that, we have partnered with these aldermen hard. I know that they know their wards, they know the community-based organizations in their wards. We have encouraged them. It is fine with me for them to say, they're going to go to this community-based organization. It does not all have to be done through the aldermanic office. Our goal here, frankly, with this surge is to get these out quickly and to get these out in places where where the need is high and where people have them. And so we did a lot of work to really make sure that all aldermen were offered these. They didn't have to take them if they didn't want, but my understanding is all of them have accepted them. And I want folks to know, this is a one-time. This is not a sort of ongoing program, but this was my team, which is very, it's a big deal to sort of do the amount of moving that this takes. But we said I got to get these out. Like, this is something that people, not everybody, there's a lot of worry right now, and it's something that we can purchase and have available. And so I feel strongly about distributing those. So we had a process. Aldermen could opt in or out, but I think they all opted in. And then community-based organizations similarly, especially the ones that we've done this with before, were able to come on. So they are all leaving the warehouse this week, and then I expect over the next, week or two, we'll see them make their way into community.
And based on that and that kind of outreach, you've got something to offer. Tell us about how you're really redoubling your efforts here with those who remain unvaxxed.
Yes.
This remains a crisis of that.
It does.
Does it not? So
it does.
How much more effective are these kinds of measures to try to get at what is clearly the thing that's holding us back? Yeah.
So for me, the masks, in a lot of ways, are an opportunity to also potentially reopen a conversation about COVID, frankly, where there's something physical, and it's not just the mask. Remember, we're doing these distribution of, here's what to do if you're sick, and trying to kind of get some of that, I think the whole world knows we're in a COVID surge, but you'd be surprised sometimes when you're talking to people if they have complicated lives, kind of what is taking priority. And so it is also an opportunity for all of those community-based organizations and aldermen and the places that aldermen decide to secondarily distribute it are able to have those conversations again. And I really want to make sure that when someone is having a conversation about a mask, when someone is having a conversation about a test, when someone is having a conversation about anything else that they are seeking, it's not just here's a mask, it's here's a mask and are you vaccinated, right? And one of the reasons why we've doubled down on Protect Chicago at Home is because that is an answer then that no matter what barrier somebody may have, I can figure it out, and not I, my team can figure it out and make sure that we can get the thing that is the most important for them. And so I do think we've seen a good uptick. We've seen more people again sort of registering for vaccination. That's part of why we made another decision to do those weekend clinics. And we're going to, trust me, we've got all these community partners, our Healthy Chicago Equity Zone leads. They're all really on it again because people are talking about this in a way that they were, and they should be, because they're all seeing friends and relatives and people who were not vaccinated, in some cases not doing very well. And I think that is I never like fear to be a motivator, but I think when people feel like it's close to them again, especially people who were depending on, I had COVID in the past and I'm protected, and seeing those people get sick and in some cases hospitalized and even die, I think has probably helped some people to maybe think that in a world where we've given almost 10 billion vaccines and seen the safety and the efficacy of those, that it may be the time right now in this surge to make that decision.
Other questions? You have a question?
Hi, Rob Sneed, WGN. I saw the correlation between those who are unvaccinated and the hospitalizations, and the numbers are there. We can see them. But yet there are still people, specifically in my family, elderly, who refuse to get this vaccine even after this time. I've showed them the numbers. I've gave them the speeches. Like, what else can I do to get this, to get them on the right track?
Yeah, thank you. So a couple things I would say. Number one is that, as you all know at this point, I am a person who very much lives in the world of data and numbers, and I look at that, and that's the sort of thing that will influence my decision. But I know that that is not what influences decisions for so many people. Frankly, what we see working is conversations with people that they trust. And so, you know, all along we've been asking, it's not just enough to sort of get vaccinated yourself, but it's having those courageous conversations with family members who have made that decision. We also have this COVID ambassador course that is available and free. We developed it through City Colleges of Chicago. You can find the link to it right on our website. That is designed for anybody. There's one that's generally, and there's one that's focused on kids. It's a short sort of online course, but we use it to train some of our ambassadors that we hire and are out and doing the work in community. But it is open to any of you. And so if you want to make sure you've kind of got up-to-date information, but also tips about how to talk to people and how to help people know that you're talking to them sort of out of love and out of concern and not out of trying to fight a political fight, is really where I try to come. For me, I am not mad at all, to be clear, at people who are not vaccinated. I'm sad for them. And the work, knowing that, you know, particularly for Black Chicagoans, at the very beginning of this pandemic, we saw this enormous racial gap in terms of who was getting hospitalized and dying from COVID. And that has to do, you know, with all of these things that the long, you know, the systemic racist systems and the policies and the mistrust of the government and the inaccess to health care and all the ways in which COVID laid bare the way that we as a society do not give equal access to people. However, right now is when we are seeing the largest racial gap in outcomes, even more than we saw at the beginning, and that is because of differing vaccine uptake. And it just worries me that especially older people still, you know, that comes from a place that I feel like, as a member of the healthcare profession and a member of the government, you know, if not me directly, all I represent, you know, have been a system that have often made people, and I think especially people of color in the U.S., not trust the system. And therefore, I know I'm not the best messenger in a lot of cases. And so that's why we've been working so much. And I want to thank all of the partners who we have been funding, but more importantly, who have been out there every single day having those conversations repeatedly. So I don't have a great answer for you, but take the course, keep talking about it, come to people, know you have to have the conversation multiple times, don't blame, question, why have you not done it yet? And then depending what the answer to that is, if you do this course, it'll give you some suggestions about how to go next.
I think you briefly touched to with the previous question, but just to reiterate, there are people out there who are saying, I've already had COVID, I have the antibodies. People still believe that they don't need to be vaccinated. What do you say to that?
Yeah, so what I would say is that Omicron is really different in the same way that, you know, we've seen a lot more breakthrough infections. We also have seen people who previously had COVID, especially if it was like last year with that with the variants before we'd seen all this transmission, in multiple studies, more than 5 times as likely to get reinfected with COVID as they were with previous variants. Like, we're really seeing almost no protection there in terms of infection, and we are seeing people get seriously ill. The very first death, I think, that was reported from Omicron in the U.S. was in someone who had previously had COVID but had not gotten vaccinated, and that was the first Omicron death. So, you know, I remain the most concerned about the still maybe 500,000 people when we look at who have neither had a vaccine nor ever had COVID. Those folks just, I'm really worried about. But the folks who are trying to depend on the protection, you do get some protection, but it is probably relatively short term, and it doesn't hold up very well against Omicron. So yeah, if you have been assuming that your prior COVID infection is going to kind of protect you moving forward, it's just not enough, and really would strongly encourage you. We don't want you to get hospitalized, to get a vaccine and to get one now.
Charlie Wojciechowski from Channel 5. We've been hearing reports about this possible Deltacron variant. Is that such a thing? Are we seeing any cases here? And what should people know about that and how it could affect them?
Sure. So just as a reminder, and to kind of set what that word even means, that word is not a formal word. It's a word that people are using. I think it's reflecting a fear that we're not done with variants. And I see no reason to think we are done with variants, just to be really clear about that. The way people are using that is this concern. Already, Omicron has almost all of the characteristics of Delta, and it has most of the same genetic changes that Delta had. But it's this idea of sort of pulling together some of what was worse with Delta with some of what is worse with Omicron. And, you know, there have been some individual cases where we've seen some additional genetic patterns. But let me just remind everybody about how sort of variants work. We see new variants like all the time. A variant just means there's been a change and we see a different genetic pattern, and you see that in more than one person. We classify these. We call them, you know, first, we don't call them anything, but once you're seeing them at all, you know, we monitor, a variant being monitored, which is where that one is. It doesn't mean that there's any public health concern about it at the moment, but it says to the whole world, pay attention to this, make sure this isn't something that we're seeing. Next comes variant of interest. When we call something a variant of interest, that means we're interested in this. It's showing up in some bigger numbers. We don't necessarily know that it's going to be bad, but it's here and we're interested. Next comes variant of concern. Omicron, Delta, variants of concern. And when it's called a variant of concern, we are very concerned about it because you have seen this happen. There actually is even one more level, which we've never had, which is a variant of high consequence, which would mean the vaccine really isn't protecting people, for example, from getting seriously ill. We've not seen that. Let's hope we never see that. But I don't worry too much about these initial, and I've said this all along, it's when you see sort of a new variant, until it's sort of a variant of interest, I'm not that interested, frankly, and until it's a variant of concern, I'm not that concerned. Please know that here in Chicago, we have used funding from the federal government to significantly build our ability to watch for variants here. We didn't have that capacity sort of as CDPH. We didn't have funding to do it. And so we have a partnership. The lab that we work with for that primary project is Rush University Medical Center, but we collect samples from across the city and they go there. Northwestern University also has a very large sort of variant program, and the other academic centers are doing some of this as well. All of that is getting combined. We see anything of interest or of concern here in Chicago or anywhere in the world, we will absolutely let you know. But really, right now, my worry is Omicron, right? And Omicron already is really putting huge pressure on our hospital systems, and most of that is people who aren't yet vaccinated, and that's why you've seen us do some of these other things in recent weeks.
As a follow-up, I'd like to ask about something we've heard about treatments. People who do recover from COVID may still suffer long-term brain effects. Mm-hmm. Some people have compared it to a chemo fog. Have you heard about that? And is that something that we've seen here in Chicago? And if so, what is the concern level?
Yeah. Okay. So lots of pieces in that. So there has been this generic term that we call long COVID. Long COVID means when someone has had COVID infection. Just to be clear, this is not COVID vaccine. This is COVID infection. When someone has had COVID infection and they have recovered to the point where they're clearly not spreading COVID. If you test them, they are negative for COVID. They, you know, are out of the hospital. They have recovered, but they're still not feeling back to where they were. And we've seen a lot of variability in terms of how that has presented. It is absolutely being studied, and it's something that's been studied sort of from the beginning. And there are clinics, again, our academic partners here in Chicago have clinics that follow people who have long COVID to better describe this. There's a lot we still don't understand. I will tell you, one of the things that was the most interesting to me as vaccines started to come out is that there were many examples of people who had been suffering from long COVID who got vaccinated and actually saw significant improvement or even recovery from their long COVID symptoms, which suggests to us it has something to do with immune response, and that, you know, your immune system is perhaps still kind of trying to fight it off even when it doesn't need to. But that's not true for everybody. There are people who got their vaccine and didn't have any improvement. I will tell you, broadly, it seems the risk for long COVID does seem to be higher when people have gotten more seriously ill. It is not impossible, just to be clear, that when someone has had a mild illness, it's not possible, but it tends to be more when someone has been more seriously ill. And it's one of the reasons why I've also heard people say, shouldn't I just hurry up and get COVID over with and get it? No. I do not want people thinking now is the time to like have a COVID party and get COVID. You should continue to do the things that you can do to prevent yourself from getting COVID infected. First and foremost, vaccinated and boosted. If you're vaccinated and boosted, the chances of you getting seriously ill are lower. The chances of you getting infected are also lower, to be clear. They are not zero, but they are much lower. You're half as likely to get infected with COVID if you're vaccinated than if you're not. Right here in Chicago, and you're not sick as long, you're not spreading as long. There's a whole host of reasons. But long COVID remains something that we're learning about. And what I'm particularly interested in is what we see after these breakthrough cases, where we've got a lot of people getting very mildly ill. I'm not very concerned, just from what I've seen, about long COVID for them, but we have to study it. Like, we've not had this before, right? In this kind of number. And so, I wish I had the answer in terms of being able to predict that for the future for people, but I can say that, and I know this is a longer answer, but bear with me a second, because I think it's important for people to understand this. Right, we talk a lot about antibodies. Antibodies are your immediate immune response after you get, when you get either COVID infection or you get vaccinated with COVID, you are teaching your body how to fight off COVID the next time, and you build up what are called antibodies. Those antibodies are the thing that is sort of the first line of defense for your immune system, the fastest part. And so what we think we are seeing, and again, we're still learning the details of the science here with Omicron, is that we know that antibody levels fall over time. We know that that happens after vaccination. We know that that happens after natural infection. One of the reasons why boosters seem to help quite a bit here is that they quickly get your antibody level back up. And so the antibody is really trying to protect you from infection. But Omicron moves so quickly that we think that there are more cases of people getting infected sort of like in their nose, because there's differences of the immune system is complicated, but to a point where they're infected, you can pick up their test. But antibodies are not the whole story of your immune system, thankfully. And when you get vaccinated, for example, you also have sort of slower parts of your immune system, your B cells, your T cells, and they don't stop you from getting infected, but they come along after the antibodies and kill off cells that were infected, stop them from being able to replicate and build and get into your lungs and make you seriously ill. And so we're still learning about it, but I think this idea why we continue to see the vaccines protect so well against severe infection is because it's not all about the antibodies, but when the antibodies have fallen, people may still get infected. So I'm less worried, honestly, just this is my hypothesis about long COVID in people who it's just this antibody piece, and really their stronger immune response that they have from vaccine is coming along and sort of, for the most part, stopping the ability of that to really get through their, their whole body and cause these major illnesses that we'd seen before. So I don't know, but that is what I am hypothesizing based on what I know about the science of the immune system and what we're seeing. But do not take this, yes, the whole world has COVID right now, but do not think that you should just go and get COVID. And there are people who are talking like that. Vaccinated or unvaccinated, we need you continuing to do the things that help keep everybody safe. And just don't be unvaccinated right now and out in the city of Chicago if you can help it.
One more? Yeah, go ahead.
Real quick, again, Ravi from Channel 7. A quick note, if you will, about somewhat the optimistic nature of your comments off the top.
Yeah.
I know you're couching it in 1,000 different ways, but you're saying that we are beginning to see the decrease of what can we look forward to?
Okay. So we are beginning to see a flattening of the increase, let's say, where we're looking at things like cases and positivity. And it is important when we're talking about cases and positivity that those are going the same way. If cases were down and positivity were sky high, that would tell me it had to do with changes in who's getting tested and how and access. If positivity was sky high and cases were down, it would tell me nobody was getting tested. We follow these two together, and the fact that over these last few days we've gone from seeing doubling, huge increases in both of these to a flattening, at least, of both of those suggests that at the population level, we are not seeing as dramatic of an increase. Other good news is that Chicago data is, we're almost all Omicron here, like 95% probably. And so there's been the opportunity for that to kind of outcompete some of the other variants, which in terms of epidemiology is actually a good thing. And then the other thing is we track things like severity indices behind the scenes, and we're seeing fewer new admissions to the ICU, even while we're seeing ICU numbers still go up from people who have been sick. We're seeing a smaller proportion of people in the a smaller number of people in the emergency department getting admitted. This is still a very bad surge, and I don't want people to think otherwise. And I really don't want people to think sort of it's over. It is extremely not over. But this hopeful flattening that we are seeing right now, I got to see it for at least a week to really trust it. There's been a lot of changes, but I am less concerned than I was even 3 or 4 days ago about where we are, but I'm still concerned about the hospitals.
And then the other thing, thank you for that. The other thing was you talked about the 77% number.
Yes.
You've got 77% of people over the age of 5 having at least one dose in Chicago. We're really still trailing in terms of pediatric numbers there, but that's obviously a number you were looking at, 77 neighborhoods and so on. What does that number have to get to herd immunity? Is there something that you can point to?
Yeah.
Are you willing to go out on that?
So I'm willing to talk about it. I think what we have seen is that COVID, in terms of traditional ways that we, quote, think about herd immunity, COVID keeps changing and keeps surprising us on that, honestly. And I've talked a lot about the need to be very humble and couching, anything in terms of those predictions. Just to go back a little bit in history, there was an enormous outbreak in Manaus, Brazil. I know this seems like a weird answer, but there was an enormous COVID outbreak in Manaus way back early in COVID, and everybody got COVID. Like, they overwhelmed their hospitals, mass graves. It was terrible. It was like one of the worst outbreaks we'd seen in a city anywhere. This is long before vaccine. And the scientists actually said, you know what, that was terrible, but this city should, in a natural way, we would think that they would have some reasonable level of herd immunity. Literally, not even 6 months later, here came another variant. Manaus got hit like terribly again. And that was sort of, to me, the first signal that kind of this traditional, where are we on this? This is not behaving like the measles. If you get the measles once, you get your measles vaccines as a child, I'm not really worried about measles in you. This is, in terms of the way it continues to change and the way it continues to evolve, it is more like the flu. And I'm always careful when I make that comparison, because I know there are people who say, oh, you're just saying COVID's like the flu, we don't care about the flu. I am not saying that. In vaccinated and boosted adults, in children, the way they are being hospitalized is more similar to the flu right now, but that is not true for people who are unvaccinated and unboosted. But in terms of where we think about what we do for the flu, every single year, we are tracking, we have ways to understand what's happening with flu. We're taking samples across Chicago. We're looking at what strain of flu, which is like what variant of COVID there is, and there's a new vaccine that's being made every year. That's why that's why there's a flu vaccine every year. I don't know that that's where we're going to be, but I don't think they're actually, just looking at this, I'm not sure there is a mythical, quote, herd immunity, just because the virus continues to change so much. And what I do know is that, thank God, we have safe, effective, and widely available vaccines, because if not, if COVID had looked like Omicron at the beginning, we absolutely would not have been able to keep up with hospitalizations. We would have seen untold number of deaths, honestly. And the fact that we have a safe and effective vaccine that is not 100%, but in terms of keeping people out of the hospital is doing as well as that vaccine is why we can be here and sort of open as a city, even while we're being careful and getting through this surge. So for me, like, I'm a little bit of an optimist. I'm always like, things could be way worse, but things could be way worse. And where people haven't had a vaccine, their risk is just so much higher, even for these bad outcomes, that it is way worse for them. And I just want fewer Chicagoans in the camp where they have the potential to be way worse. You know, my team is talking to me every day. We've got pregnant women on ventilators, you know, like with COVID. And I know that people get their information from a lot of different places. And I know, again, like I said, there's a lot of history of mistrust. But honest to God, like, my only goal is to help keep you safe and your family safe. And that means getting a vaccine.
Thank you.
Thank you, everybody.